In this session, myself, Bernard and Megan will be talking to you about the wonderful world of public and patient involvement, or PPI, within the NHS and other major funders. The reason I call it the wonderful world of PPI is because there's no one perfect method, there's no one perfect way that is generalizable across all research studies. All research studies will have their own specific requirements, and therefore your PPI will need to be fitted around what you're doing within the research. However, in saying that, there's also a very good collection of guidance available for planning your involvement in PPI, just how the specifics of how you do this will change. NIHR, and indeed nearly every other funder in applied health research, have specific expectations for PPI in the application, so please read the guidance for whichever funder you're going to, given that there may be nuances of what they're expecting to see or how it should be presented in the application. Overall, there are two main requirements for PPI for applications. The first is what's known as pre-grant PPI activity. So prior to the submission of your application, you're expected to connect with members of the public or patients, PPI contributors, who would discuss your application, your research methods, what you're planning prior to submission of the application itself. You also require a robust PPI plan for if and when the research is funded. The PPI plan is really what you intend to, what you're expecting the PPI to do during the research, when they're supposed to be doing it, and indeed why you have people doing, why you've involved PPI at these particular stages. I'll come on further to how to do this a little later. However, the most important point really is to start early. Seriously, start early. This isn't PPI, developing your PPI. Being able to have pre-grant PPI activities will not occur if you leave this for a month before your deadline, or indeed potentially even 2 months before your deadline. You should be thinking about this at minimum 3 months, because it does take a lot of time. It can take a lot of time to recruit participants, to talk to the PPI contributors, to report back what you're doing, and also to make changes to the application. So if you have a funding application coming up in July, you need to start now. Why is PPI important? The most pragmatic reason is because if you don't include it in NIHR or most other funding applications, you're going to probably have a very good chance of failing that application or having it rejected. It is a requirement, and it is expected to be included in pretty much all project as well as fellowship applications. The reason for why this is most important is based on two things. The first is democratic principles. Patients and the public will be directly affected by the research, and more so than this, patients and the public, or the public generally, are the ones funding this research. Applied research in this country is mainly funded through either government or charitable organisations. Now, this is funding that comes from the public itself. Therefore, they have a democratic, moral and indeed ethical right to be involved in some ways of how you would be performing research. They do have the right to say how this research is undertaken. For me, however, being a research, the most important reason is that involving PPI actually improves your research. There's very good evidence available that involving patients and the public can improve the quality and the relevance of your research. It can improve the relevance of your research question, your aims, your objectives. It has been demonstrated to improve recruitment rates quite considerably. Outcomes are more relevant to patients when they're involved in the actual research, and dissemination is often very much enhanced by the fact that PPI are involved. So for me, I think it's very important, and I think for most others, that having PPI involved in your research will improve it. Importantly, for young early career researchers and even older ones, working with PPI isn't as frightening as it sounds. They are actually more interested generally in how you're doing things than the final outcome. So being able to have conversations with people about your research becomes much easier, and just try and get over this fear that you may have about working with PPI. The what of PPI, this definition is the most used definition. You'll see it quite often. It originally came from involve. Public involvement in research is defined as research being carried out with or by members of the public rather than to, about, or for them. So this is not a top-down approach. It's supposed to be far more collaborative. PPI are not research participants. They will not be filling in your questionnaires. They will not be participating as interviewees in semi-structured interviews. However, as PPI are actively involved in the research projects, the PPI contributors would be the ones assisting, potentially writing and refining your participant information materials for the questionnaire study, or they may be, or they're expected to be involved in helping you develop your semi-structured interview schedule for your interview series. So PPI can help design, conduct, and disseminate research as well as a lot of other things. This is where it becomes slightly confusing, but it's okay, we'll go through that. The who of PPI, these are the 4 bullet points you will normally see about who are PPI. This is patients, current, former, and future. Already we're starting to see that's everyone. Carers, parents, guardians, teachers, they can be drawn from patient or public advocacy groups or charities. They can also be people who use health or social services. So basically, it is everybody, with the exception that the perspectives of patients and the public, their knowledge, their experience, their views, expectations will be different to doctors, nurses, clinicians, researchers, and managers. Although if you're a healthcare professional, you are very good at diagnosing, managing a particular condition, you might have extensive experience in it. What you don't have is what your patient will have, which is lived experience of the condition. This is what you're really looking for in terms of the who of PPI. You want people who have lived experience, understand what it is like to live day in, day out with a condition. And it's not simply their knowledge of the condition that you're looking for here, because also their own experience of care, the treatments, the delivery service, or if you're a carer of, or if they are a carer of somebody with a long-term condition, their experience as well. There is a massive difference between how healthcare professionals see the delivery of the service and how patients will see the delivery of the service. It's often quite interesting to find the surprise on clinicians' faces when they find out what they thought of, when patients tell them truthfully what they thought of the delivery of the service. As part of research, you're wanting to improve that delivery, and therefore listening to the people who actually experience it, who have lived experience of it, will be far more valuable than listening to your colleagues. Lived experience insights are valuable for the design, conduct, and indeed communication of findings. As a PPI representative for the NIHR stated, researchers may have a textbook knowledge about different conditions, but unless they've also lived through it, there will be gaps in their knowledge. And your job as a researcher is to elicit these things to make your application and your research proposal far more impressive to a committee. What do PPI people do? Well, PPI are actively involved in discussions and decisions about the research. Now, if you put into your head that PPI contributors are actually part of your research team, much like a statistician or a health economist, then you're in a good place. However, do treat the PPI much better than you treat statisticians and health economists, because when we say actively involved, this does not mean that we're having 2 meetings a year with the PPI and that's all you have to do. They need to be integrated more into the research than that. And there are 2 types of ways to do this. One is task-based and the other one is discussion-based. Discussion-based do tend to be these organised meetings that you will have periodically throughout your research. However, task-based ones, for example, early stages, you may have a task-based one about the writing and refinement of your patient information materials that need to go to ethics. You're probably going to have several meetings close together around that period. There may be then a break. However, your next phase of research, the expectation is that they would be involved in that. If you have 3 phases of research and you've only included PPI in one of them, that is going to look very, very poor to a reviewer, especially a PPI reviewer. For the NIHR, PPI is expected to be involved in the design of the research, developing the funding application, undertaking the research, interpreting the research findings, and communication and dissemination. Now, that sounds a little difficult. However, it's actually quite easy as long as you use certain techniques, which is mainly open communication and listening. The research cycle. Many of you probably have seen this already. We start at the top right, identifying, prioritizing. We move around to design, pre-grant, developing proposal. This is all pre-submission. Then you have undertaking and managing, analysis, interpretation, and dissemination of results. Tends to be the project itself. Impact and implementing, monitoring, and evaluation tend to be outside most research projects we see, as they tend to be long-term ones run by much larger departments and often are outside the research itself. From the RSS position, this is what we normally see, is that people do quite a bit in terms of thinking about their design stage, the pre-grant, the developing proposal, they're involving their PPI in that. However, then they bookend it and they go from pre-submission, also what they have been doing prior to submission of their application. And the next thing is the PPI turn up disseminating the results. They don't seem to have been involved in undertaking and managing or analysis and interpretation. Now, we're not expecting PPI people to do multiple linear regressions or to be able to have the skills of a researcher. However, it is possible to uplift many of the PPI. As I said earlier, PPI are very interested in how you do things, and you can actually offer training to people so they can be more involved. Now, this can be bespoke or formal training, but undertaking and managing an analysis and interpretation can be done in a variety of ways which enhance your PPI plan to demonstrate to committee members that your application and your research proposal does have high quality PPI in it. So please don't bookend the PPI, have them going throughout and in each phase of your research. Do all studies need PPI? Generally, yes. It is now a health, if you're submitting for ethics, there are 6 questions in the HRA application and the NRAS application that asks you 3 of those about what you did before you submitted your proposal and 3 about what your PPI plan is. So do all studies need PPI? Generally, yes. At least applied health research. I'll come on to something in a second. PPI is a requirement, nearly all applied health funders. This is expectation that you're going to recruit a small group of people with relevant lived experience to discuss the prior study prior to submission of the application. And hopefully, and this looks fantastic for NIHR applications, that same group of people who you discussed prior to submission then form your PPI group. So a small group of people who will contribute to the entire study and beyond. What you do not want to have is I will recruit PPI after I've started my research, mainly because we're uncertain whether or not there was good pre-grant activity. Why did none of the people you spoke to want to be part of your research is a question that comes up. So in an ideal world, you try, when you recruit people for your pre-grant activity, hopefully you'll be taking them forward to the entire study and beyond. And also, you can also discuss with them the PPI plan during the pre-grant activity stage so that you can inform the readers of your application that this has been discussed and agreed in advance. The pre-grant activity, prior to submission of the application, generally you have a very short amount of time to do this. The RSS offers some support, however, it's fairly small in terms of the number of people you can do and the amount of time you can actually do it. What you're looking for from the pre-grant activity are questions that you're not trying to refine an intervention, you're not trying to do anything major, you're trying to find out key components of your research proposal that you can populate with the views of the PPI. So for example, in section 2 of most NIHR application, there is, why is this important? One of the questions you would ask during your pre-grant activity is, why is this research important to you? You can then use that information and put it into section 2, saying this is what the PPI think of why this is important to undertake. What you're also asking in there is questions around, are the aims appropriate? Are the outcomes understandable to the to participants? Questions around recruitment. How burdensome is your research design on people with the condition? And also, how might they be involved in dissemination? Added to this, and again, this is a lot of questions to ask in an hour and a half meeting, but it's also about the PPI plan itself, whether or not they agree. Many researchers, for example, will say we'll have monthly meetings for the 3 years of the research. You go to the PPI and they say, actually, we have a life. We only want to do this every 3 months, as it seems a bit burdensome on us. Therefore, you would change what you would indicate that in your application, that originally it was a discussion that we had anticipated having monthly meetings with the PPI group. However, after discussion, we resulted in once every 3 months based on the PPI's views. This is something excellent for a PPI reader to see, because it demonstrates that you have discussed the PPI plan and also that you've listened to them. Your PPI plan is going to be based on either task-based or discussion-based meetings. What we tend to suggest is that there will be times of strong activity and there will be lags between certain things. However, part of what you're trying to do, especially in undertaking and managing the research, you can offer training to people, or you can simply, if you've got preliminary results, organise a meeting with the PPI group just to discuss what you think are the most important results and what they think are the most important results. This may actually change what you're doing, or it may enhance what you're doing, because you suddenly realise that, for example, with one of my studies, I thought participation and screening was more important. I went back to my PPI group and they said, no, we think self-efficacy is more important, and that should be the main outcome or the main point of dissemination from the research. And we did that instead, and it was far more successful than just participation. Costings for PPI, a word of caution. Every university, apparently, and even down to departments within universities, will have different ways of costing. Now, we have a general overview agreement nationally for what should be costed. However, the way payments are made, the way they're supposed to be, PPI contributors are supposed to return their reimbursement forms will be slightly different probably in every one of your institutions. So go speak to finance as early as possible, because another problem for payment for PPI is that if you have anybody who's currently on benefits in this country and they get paid above the level they're supposed to for a particular week, they will lose all their benefits. It is an enormous problem that has come up on a number of occasions, and one which is also stopping certain members of the public from being involved. So please go and talk to your finance people very quickly and very early to ensure that you're not making any mistakes and that what you're telling PPI is the correct thing. Payment for time is £25 per hour. This includes any reading time. For example, if you have a 2-hour meeting, the expectation is that they would PPI would be paid £50. However, if there's 2 hours of reading time prior to the meeting, that would be another 50. So the meeting would be £100. You're also expected the normal things such as travel expenses, car parking, venue hire, refreshments, covering childcare or caring expenses, translation, interpreting costs. Formal training and courses we tend to have within your research proposal as opposed to prior, but however the NIHR are quite happy to pay for training, formal training courses for PPI if included in your proposal and justified. NIHR view of PPI for project and indeed fellowship applications. You have the pre-grant activity, you have the plan for funded research. Now, in stage 2 applications, you have 350 words to explain your pre-grant activity. You have 350 words to explain your PPI plan. However, and ideally, you will also embed PPI throughout your application. I spoke earlier about embedding PPI in section 2. You can also do this within the research plan. When you get to the recruitment stage, you can indicate, reinforce the fact that you've spoken to the PPI and they have agreed that your recruitment plan is appropriate and not burdensome. This makes it very difficult for a committee member to criticise this because you've already asked the question and the PPI have already said yes. In stage 1 applications, please do not make the mistake, because there is not a dedicated section in there for PPI, that you subhead a particular section. And I would suggest using around about the same number of words, A, to indicate your pre-grant activity, and B, to indicate your pre-grant, your PPI plan as well. If you don't put it in, although there's not a dedicated section, if you don't put it in, we do know that a lot of people have missed out on funding simply because it's like there is no PPI in this application. For project grants, there is also a requirement for the NIHR of a PPI lead. I'll come to that in the next slide. They need to be a co-applicant as part of the research team. This does not necessarily mean they have to be a PPI contributor. They can be one of the researchers. It just depends on how you want to organise your proposal. Also a requirement, and apologies, we can't go through this in detail, is to evaluate the impact a PPI has on this research. There are a number of texts and guidance available for how to evaluate the impact of PPI. Some of it is quite straightforward, such as keeping PPI activity meeting logs, which is basically meeting notes. However, always a very good way of ensuring that anything that's been actioned, that the PPI want actioned, that you have done so, because at the next meeting, you're going to have to report back on it. You can interview the PPI contributors to feel how well they, to understand how well they think their contribution has made to the research. And indeed, if you do this in a high quality way, you could end up well with a publication. Research involvement engagement, for example, is one of the few journals which accepts PPI-based research to explain what how the PPI contributors felt about their involvement, their outcomes, and any lessons learned, for example. The NIHR make no bones about this. They say they expect appropriate and well-designed involvement of patients, service users, carers, the public, and other key stakeholders in the research it supports. So from the NIHR view, do PPI. A PPI lead is a member of the research team. They facilitate, liaise, and support PPI throughout the research. They are leading and managing the PPI plan, adequately costed and resourced. And they can involve delivering bespoke or formal training to PPI contributors. The NIHR define a PPI lead as having the relevant skills, experience, and authority to be accountable, represent, manage, and embed PPI in all aspects of their research. This basically means that you need to have some experience in PPI or some experience in community engagement, for example. That would be sufficient to be able to demonstrate the relevant skills, experience, and authority. However, you must have a PPI lead. They must be costed well, and it can either be a researcher or it can indeed be a PPI co-applicant. Importance of EDI. EDI stands for Equality, Diversity and Inclusion. After 30 years of research, finally we're seeing traction with this within the NIHR. They take it very seriously, as do a number of other funding bodies. There's overall lack of representation of the seldom heard groups in research, service delivery, and obvious health and care inequalities. Inequality includes age, race, ethnicity, disability, gender, religion, geographical location, socioeconomic status, just to name a few. In terms of PPI, you need to ensure your PPI contributors are representative of all the people that would benefit from the research. If you're doing a study on in primary care about pre-diabetes and the improved diagnosis and management, we already know that this is primarily a major risk factor for Asians over the age of 25. If you have 4 female Caucasians as your PPI group who are all over 60, they are not representative of the population at all. This will be most certainly picked up by committee members. Therefore, you want to ensure that your PPI contributors are representative of the population that you are actually going to be investigating. These are the UK national standards framework for what good public involvement in research looks like. This is not a toolkit. It's more of a way of framing what you should be doing in your head. There are 6 standards designed to encourage reflection and learning. As I said earlier, this is very much a collaboration between yourself as the PPI lead or one of the researchers involved in the study, to try and ensure that you're collaborating well with your PPI group. You will be differences between dealing with researchers, dealing with members of the public or patients will be different to dealing with researchers. So these standards are there to try and remind you of what are the aspects that you should be looking at. So these include flexibility, sharing, learning, and respect, intended to be used with any model, method or approach to public involvement. These are the standards. So your inclusive opportunities, we talked earlier about EDI, for example, offering public involvement that are accessible and reach people according to their research needs. Governments involving the public in research management, regulation, leadership and decision-making. If you have an advisory group as part of your research, the expectation is that you would have at least 2 PPI members from your PPI group also sitting on that advisory board, and a very good idea to indicate that PPI is a standing agenda item, and that's the first agenda item that you'll actually be discussing at all of your major stakeholder meetings. What support can we offer from the RSS? Well, officers, managers in all NIHR research support organisations are available to help. We review proposals and advise on PPI strategic plans. We help signpost and helping to advertise for PPI contributors. We don't tend to recruit for you. It's your research, and we've got many, many projects that we're looking after, so we can't do that, unfortunately. There's also limited funding available for pre-grant PPI meetings and activities called the Public Information Fund. This ranges from about £300 to £350 only. So it's a small amount of money to hopefully help get a meeting form with PPI contributors so that you can do your pre-grant PPI activities and inform the rest of your application. So hopefully your departments or your units will also stump up some cash to try and help you do that pre-grant activity, given the importance it will have on whether or not your application succeeds. Other resources, the UK Standards for Public Involvement. There's also the NIHR briefing notes for researchers. If you read the old Involve briefing notes for researchers, they're basically exactly the same. There's the brief guide to public involvement, which the RSS or the RDS, Megan, in fact, did that a while when we were previously the RDS. And there's also if you Google in NIHR PPI resources, you're going to find the one-stop shop for all NIHR PPI related resources available. This includes EDI resources as well. The costing resources will make your eyes bleed. However, there's 2 types. One is the one up here at the moment. This is the guidance for researchers and professionals. This is the document you probably want to read and then go speak to your finance person about. Because it is quite intricate, and as everyone who's ever written a proposal before, costings are always a bit of a nightmare. Evaluating PPI and research, there's a very good tome from University of West England, which has 4 different techniques. 2 of those are very large. One's called the Cube, and you need quite a number of PPI for that to work. So sometimes evaluating PPI in your research will be based on how many people in your PPI group. There's also the Equality, Diversity and Inclusion Toolkit available as well for trying to improve the way that you may recruit and how you conduct your PPI with people from minority or seldom heard groups. So PPI is an essential part of the development and writing of your application. Important to involve people who have lived experience and who are representative of the group with the condition. Please read the guidance. Funders will have different interpretations of PPI and different ways that you're supposed to express this in your application, and try and develop a draft PPI plan when writing your proposal. And this basically means that every milestone, see where you can fit in and how you can fit in PPI into that particular part of your research. Not as scary as most people think, and most usually rewarding. Indeed, 95% of people I've spoken to about who were genuinely scared about doing PPI have come out the other end and said it was absolutely brilliant. I had no idea why we're not doing this before. So it will take time and effort, however. So again, be early, be organised, and treat your PPI representatives as you would treat any other researcher. Okay.
Well, folks, you've heard what I might describe as the official story from Paul, but I'm going to give you my own idiosyncratic view of what PPI is like from the point of view of a patient. Now, a little while ago, the NIHR called us a patient advocate. And what does that mean? Well, according to the Oxford English Dictionary, a patient is a person receiving or registered to receive medical treatment. And that's certainly me. It's probably most of us at some stage during our lives. But patient as an adjective can mean someone able to accept or tolerate delays, problems, or suffering without becoming annoyed or anxious. And that is not me, I'm afraid. I quite like the term advocate, though. It's a person who publicly supports or recommends a particular cause or policy, a person who puts a case on someone else's behalf. And I think those two are very important within PPI. But let's just take a moment to look at the crisis that we all know is affecting the whole of the medical world at the moment. Here are a few headlines. Operations cancelled, cancer waiting times up, diabetes spending going up, dementia crisis, 6 million on waiting lists, cancer treatment straight away, no space for 4 months, number of patients waiting to see their GP soars, etc., etc. So why is this relevant to PPI? Well, just to reiterate what Paul said, who is PPI? Who or what are PPI? They're patients, current, former, or potential, carers, parents, or guardians, people who use healthcare services, patient and public advocates, and charities. And I think you'll agree that includes almost everyone. But the point I want to make is we're not just one amorphous mass. We are all actually very different. And patients can become experts by experience, a term used regularly by the NIHR. And patient-centered outcomes can actually affect and improve research questions. So why is PPI important? Well, the backlogs and the costs are spiraling. The public must be involved, as ultimately most research is funded from the public purse. So as taxpayers, we have a right to ask what's happening to our money. This I find incredible, but it's the result of some very reliable research that amongst patients with chronic illnesses, 50% do not take their medication as prescribed. And that I find quite amazing. And here's the first instance of PPI, which comes from Hippocrates. I don't quite like his wording, but you'll get the message. He told physicians not only be prepared to do what is right, but also to make the patient cooperate. And I think, as Paul mentioned, there is an interactive map of funding schemes, which may be of interest to you. So what is PPI? Well, a lay member can say how it feels. You're almost certainly saying to yourself, that's very unscientific and has got nothing to do with my brilliant bit of research. But actually, it's vital to the patient. People who live with chronic conditions, as many of us do, actually want to feel better. Less than 20% of patients are confident about asking their doctor, be that a GP or a specialist, about research. We provide an independent voice from patients. We're not lookalike researchers. And as Paul has said, for grants from the NIHR and increasingly from charities, The lay view is absolutely essential. And we are people who can help and can support you. And that is what we want to do. We want to help design, interpret, and promote research. And sometimes we can contribute in ways that you can't. So feel free to see PPI as a resource, not as a research resource, not as someone who can do your job for you, but as someone who can contribute to it. So let me now just put up a few things that occurred to me. As a PPI contributor, I have a life outside research. Honestly, I do. And I don't sit at my computer waiting for your email. So if I was to make maybe 3 particular points, I would say get advice from your PPI contributors as early in the project as you can. It's really quite unnerving and annoying to be brought into a project when everything has been set in concrete. Get some PPI input very early. And as Paul hinted, there are bits of seed money to enable that to happen. And keep PPI contributors involved throughout. Let us know when you're going to want us. Don't suddenly email and say, we're having a meeting tomorrow. Give us time. Let us know what the timescale is for the project, when you expect the main meetings to take place. And yes, I know delays do occur. That's inevitable. But let PPI contributors know that as soon as you can, and with a revised date of when you're going to require some input. Some more points. We don't like feeling we're just being a tick box. The NIHR says, I've got to have some PPI input, so it's you lot, tick. That's not very motivating. And a lack of planning on your part does not constitute an emergency on mine. If you haven't planned your project and suddenly expect a whole host of input from PPI, it may not happen. It's very annoying to have an email arrive at 5 p.m. on a Friday, which says, sorry for the short notice, but I have to submit this by 9 a.m. on Monday, so please reply over the weekend. And if you think, oh, that would never happen, yes, it does. It's happened to me. So the assumption is I have nothing to do at the weekend except read whatever you've sent me. Another point to make, which Paul alluded to, is that PPI members often have real life experience that may be useful to you. For example, if you need to design a questionnaire, people who come from a marketing background may well have experience of how best to phrase it. So they may be the most appropriate people to call on for that bit of PPI input. And don't be afraid to do that. But above all, please ensure there's feedback to PPI contributors when you complete your project. I was asked only a few weeks ago to comment on a plain English section and PPI input to a project. I have heard nothing back from the researcher, even though I sent my comments in good time. He's probably very, very busy, but has he not got time to type THANK space YOU? Well, if he hasn't, maybe he hasn't got time to do the project. So please do provide feedback. Paul also referred to a successful PPI group. The PPI people on your project will be part of a group and they'll want to feel part of a group. What's really important is that the principal investigator, that may well be you, and any co-investigators should attend all PPI meetings. It's often useful to identify a research translator. with knowledge of the objectives to challenge the research team. This is someone who can often help if by chance you use acronyms or jargon in your work. The research translator can often translate them for the PPI group. Identify the critical decisions that the group need to take and have a clear process for reaching conclusions. So make sure there's a published timeline, a project plan when the PPI group will be called together. And by having a clear process for reaching conclusions, what I mean is, how are you going to get the PPI group to come up with a recommendation? Is it going to be a majority vote? Are you going to have some sort of roundtable discussion? How are you going to go about it? And avoid overloading them. 2 or 3 topics per meeting are probably the most that people can take. If you've got half a dozen burning questions, don't expect them all to be dealt with in one meeting. And go at a reasonable pace. We're not into research the way you are. And to just reiterate the point about EDI, ensure a spread of ages, experience, and disease type, so that you do have a representative sample of people on your PPI group. Maintain contact throughout the research. I know there may well be a long period of months when nothing appears to be happening, but if you're in the PPI group and you hear nothing, it's a little bit unsettling. So if you have someone who is the PPI lead, could I suggest that they write out on a regular basis, even if little has happened, but at least let people know that everything is still going, everything is still on time, and so on. And finally, the meeting should be relatively relaxed and adequately funded. Bear in mind those payment rates which NIHR recommends and which are now widely adopted. So what can PPI achieve? Well, as I've said already, patients have experience of living with or caring for many conditions and become experts by experience. They can help prioritize research questions, and patient-centered outcomes can actually change the research questions. They can make the research more relevant to patients and ultimately provide better value for money in terms of what is recommended. We can help prepare patient-facing materials, public-facing materials, and in promoting results. And believe it or not, well-argued patients' and public opinions can be more powerful than the views of academics. The research team will have greatly improved communication skills and a clearer insight of the potential impact of their research by employing PPI. Now, you may think that perhaps we're 2 very different camps, and perhaps we do have some different aims. As a researcher, you're probably desperate to get your project through the ethics committee, to get the funding, to publish a paper, and to have some numbers that will be crunched by the statisticians. As a patient, we're looking for a better quality of life, a better understanding of how to manage our condition, and believe it or not, to help research. So we do have some shared aims, which is to encourage participation, to promote research, not just your project, but research in general, and continuous improvement within the NHS, reduce costs, encourage communication, share ideas, and on occasions to challenge conventional approaches. I'm sure you've seen this before. The two donkeys, which are tied by a rope, are trying to eat, and neither of them can get to their pile of hay. But if they work together and eat one, they can then move across and eat the other. And that's something that actually summarizes the importance of teamwork in research. Paul made reference to your project, and here are a couple of illustrations. And I wonder if this is your project. Well, perhaps your project is like this. You will find that a number of us, when we had lives outside PPI, were involved in large projects, and we know all the buzzwords that go with it. So please be honest about your project and involve us in it. If something's not running to time, tell us and we'll help you. And now I'd just like to say a word about presenting to a funding committee. This doesn't happen for all projects, but for some, you will be asked to go and present in person to a funding committee. And when you walk into the room, it will look a little bit like this. There will be many, many people arrayed around, and you have to sit at that single chair in front of them. And it's quite overawing at first. Be prepared for it. And amongst the people around the table, there will be probably 2 or 3 PPI representatives, and they will ask you questions about your proposal. The other thing that it's worth saying is that very often you will be given a very strict timescale in which you have to present your proposal. And if you're asked to speak for 5 minutes, that means 5 minutes. 4 minutes, 59 seconds is okay. 5 minutes and 1 second isn't. You will be stopped by whoever is the administrator for the meeting. So again, I would say practice, practice, practice giving your spiel for your project long before you get into the room. It should come to you automatically because you know it so well. And the other thing to say is that applying for funding is a little bit like this. These are stone steps, and it feels as though you're falling down them all the time as you try and get funding. Don't be put off, accept the bruises and go for it. Finally, as a PPI rep, what is my checklist? First thing I ask myself is, what is the patient benefit? If that's not spelt out, there's something wrong with your proposal. What are the risks? It's good news that frequently the risks are very, very minor and they never happen. But occasionally in research they do. So be prepared to spell them out. What involvement have you had, past and future, with PPI? What's being asked of the patients? Is it practical? One project I was asked to review was for people of working age, and they had to go into hospital every morning at 10 o'clock to have a blood sample taken. How practical is that for somebody who's working? What about the financial aspects of PPI? If I look at your proposal and it says you're going to have a meeting with 50 PPI people and they're going to take place every month and we've allocated £50 for it, I have my doubts. What are the opportunities for improving PPI? Have you got a diverse and appropriate PPI group? What about the research team? Are they a good and well-balanced team? What science and engineering is involved? And are there any real concerns? Is there anything else I ought to be looking at? And you'll be pleased to hear this is really the end, but I will summarize by saying you're doing a vital job that's essential, worthwhile, and useful. Please keep ploughing on, and as a volunteer, I will help you whenever I can. But please help me to help you. And finally, Leonardo da Vinci said, simplicity is the ultimate sophistication. But Einstein said, everything should be made as simple as possible, but not simpler.
So I've been keeping an eye on the chat actually while Bernard and Paul were talking, and quite a lot of questions coming out around the sort of practicalities and the sort of how do you go about doing patient and public involvement. So hopefully this short presentation will be helpful in that respect. I'm just going to talk through a couple of case studies just to give you a little bit of an idea of some of the ways that you might look to recruit, engage and deliver on PPI activities. So very quickly, and I'll whiz through these next few slides because Paul did cover most of this in his presentation, but I just wanted to reflect on this just briefly again. So I think one of the first things you want to consider is who your patient and public involvement representatives are, who's going to be best placed to contribute meaningfully towards your research. So ideally, you'll be working with members of the public who have some lived experience or insight into what it's like to take part in your research, or what it would be like to benefit from your research. So Bernard said in his presentation, it allows for the public member to kind of advocate for and provide insight into how it feels to potentially take part in research. So again, to use Bernard's example around how it would feel to take part as a participant, given all of the potential limitations or challenges of living with type 2 diabetes, you would want to speak to someone who had that lived experience. As Paul mentioned, there are some groups that are generally not considered PPI by NIHR, so kind of healthcare workers. Depending on your research, you may want to speak with these people anyway, and you may want to have kind of broader stakeholder engagement conversations with them, but technically this wouldn't be considered PPI. Okay, so as well as considering if your PPI representatives have some lived experience of the condition area, it's really important to think about how diverse they are in terms of representing a broad range of views. Your PPI work will never be truly representative in the sense that you won't be using kind of sampling techniques and things like that, but I think you can kind of use common sense to try and kind of seek as wide a kind of range of perspectives as you possibly can. Becky is talking after the break and she's going to go into a lot more detail around DD&I, but I just wanted to reflect on how crucial it is to think about and consider when you are planning your PPI activity. So we know different demographics of people are likely to have different barriers and facilitators to taking part in research, as well as different priorities, different desired outcomes. We know that participants of research are not, if participants of research are not representative, then we can end up with results that are skewed towards a particular population, and this in turn could actually have the effect of worsening health inequalities. So it's really important to consider this, and one way to kind of potentially mitigate this issue is to seek input from a diverse range of PPI contributors as early as possible to kind of help you overcome some of those barriers to participation. Okay, so in terms of recruiting for and setting up a meeting, there's so many different ways that you can kind of try and identify PPI representatives. You may go to an existing group, you may contact a charity who has links in patient groups and in the community. You may go into a community space to talk to people on the ground. You may seek some help from organisations like the RSS who hold databases of public contributors. Particularly if you're clinical, you may reach out to individuals on a one-to-one basis. So kind of within a clinical setting, you could give out a leaflet, or you could kind of speak to somebody and ask if they were interested. It's important at this stage that you kind of provide a really clear overview of your project. You make sure that you're clear about exactly what you're asking of them and whether they're going to be kind of paid, what will be expected of them in return. And you need to decide on things like a meeting. So kind of, where is that going to be held? Is it going to be group, one-to-one, in a community space, etc. In terms of running a session, I think it's useful to have a rough agenda. So you don't need to be too formulaic. You can allow the conversation to be quite kind of organic, but it's useful to have a rough agenda so that you're kind of structured and you make sure that you cover the kind of main points. It's really important to be kind of clear and use plain English, have good facilitation skills. So think about who in your team might be the best person to do that. Is somebody going to be taking notes? If so, have a think about that beforehand. And bear in mind that initial conversations can be used as a starting point to kind of as a starting point for future collaborations. Okay, so I'm going to just move on to some case studies now, and hopefully these will be useful in terms of thinking about doing PPI in some populations that might be considered underserved or kind of less well represented in PPI and research. So the first example I'm going to discuss is a PHR public health research project, which we supported on. So this project ended up being funded, and I actually ended up becoming a co-applicant and delivering on the programme of PPI work in this project. So the full title of the project is Gateway, a randomised control trial, economic and qualitative evaluation to examine the effectiveness of an out-of-court community-based gateway intervention programme aimed at improving health and well-being for young adult offenders, victim satisfaction and reducing recidivism. So it doesn't roll off the tongue, but there's a lot there. I think just to kind of give a very rough overview of the project, I thought it would be helpful to kind of go through a PICO structure just to give you a bit of an idea about exactly what the project was about. So the population that were being recruited were and randomised were young adults, so age 18 to 24. And these are people who'd been charged with a crime of a particular category. So, for example, things like sexual or violent crimes were excluded. These individuals needed to have accepted responsibility, so they needed to have admitted guilt for whatever it was they were being accused of, and their arrests were going through Southampton Constabulary. The intervention, a programme called Gateway, was a 16-week programme. It was conceived and developed by a not-for-profit organisation called Hampton Trust, and Hampton Trust specialise in supporting victims of crime as well as working with perpetrators with a focus on rehabilitation. So this particular programme focused on working with these young adults in the community on a weekly basis to try and help address some of the kind of broader needs that might have been causing them to offend. The comparator, was usual care. So the control was essentially going through the court system. So going through the process that you would normally have gone through if you found yourself in this position. And the outcomes that we were collecting were a range of sort of self-reported health and well-being measures, which were collected across a year, and that was collected alongside recidivism, which was routine data and collected for 5 years. So we were really keen to understand what outcomes were most important to this group in terms of health and well-being. Additionally, we knew that research in this particular population can be challenging. So these young people often have sort of complex challenges and are leading chaotic lives and have kind of multiple issues. So with that in mind, we really wanted to explore some ideas around the barriers and facilitators to kind of recruitment and retention. This included understanding some of the main concerns of young people and what they would be worried about taking part. We were also keen to understand which format would be best to share information with young people about the study and how we could kind of properly talk to or kind of recruit and promote using adequate information. So in terms of setting up a PPI meeting, so we knew that we needed to speak to young adults with experience of the justice system in order to try and kind of understand some of the unique challenges that this particular population might face. So in order to do this, we partnered with Hampton Trust. So that was the charity that developed the intervention. As part of their work, they run a number of similar courses with young adults who have kind of been committed of crimes and things like that. So they actually advised us that if we tried to bring together a PPI group, then it would be really challenging and probably wouldn't work. They instead suggested that we attended a workshop that they were already running. Young adults there would be attending as part of a court order. That way they would be there already. We wouldn't need to kind of ask people to kind of commit and travel to an additional meeting. We wouldn't need to kind of go through all the logistics of trying to organise it as such. So we attended the workshop, and after it finished, we gave a very brief 5-minute overview of why we were there and what we were hoping to achieve, and asked if any of them would be willing to stay behind for an extra kind of 45 minutes or so to chat to us about the study with us. We offered them a voucher in exchange for their time, so a shopping voucher. Around about half the group decided to stick around. So that was about 5 people, and we stayed for about an hour with them and talked through the project, and we got some really fantastic insight and feedback from them. 2 of the individuals that stayed were then happy to be contacted again, and we met with them on a one-to-one basis at a location of their choosing to discuss their views in more depth. So it just so happened to be at a cafe near their house on both times, but we were trying to make that just as accessible and easy as possible for them. The feedback from the sessions was incredibly valuable. So young adults were all really interested in mental health and how they felt that support in this area was something that they didn't have access to, but could have a real impact on them. So they felt very keen that that was something that we recorded and we made sure was kind of one of our outcome measures in the study. They were also very keen on kind of areas that they perceived to have a very tangible benefit to their lives. So this was things such as support in education or support in housing. One of the things that came up as a significant barrier to recruitment was tied up around distrust of police. So the recruitment process was being supported by the police. And this was kind of identified as a challenge. So as a result, we had to think quite carefully about how we would try and separate the university team from the police team and be really clear about our distinct roles and communicate that effectively. Privacy and data was also a really big concern. So particularly when discussing things like drug use, which was one of the outcomes that we were capturing, it was felt that data could potentially be used against them. And so we talked through with them about how we should present information relating to privacy and data sharing and things like that. And lastly, data collection, so sort of questionnaires and things like that had originally been planned to be held at 2 locations in Southampton. But this was also identified as a significant barrier. So PPI representatives felt that remembering appointments and travelling across the city, especially if they didn't have cars, would mean that a lot of participants would probably just not turn up. Also, a couple indicated, and this was something we hadn't thought about at all, but a couple indicated that there were sort of regional rivalries between particular areas of the city that we kind of hadn't considered, and that some young people might be caught up in this and as a result wouldn't travel into particular areas. So we ended up doing quite a lot of work with community partners to try and identify a whole range of different locations and spaces across the city that we would be able to use as kind of qualitative interview sites, essentially. we also had to plan for our ongoing PPI. So in terms of what we decided for that, we did identify a PPI collaborator who worked. He actually had a job as a mentor for young adults in the justice system. He identified himself as an ex-offender, so that was kind of how he referred to himself, and he'd had a challenging youth, so was able to provide a perspective on a personal level, but was also someone who kind of now works and advocates for these young people. And he was able to join us in a kind of more professional capacity. So on a regular basis, he would join steering committees and things like that. And he was able to kind of commit to the duration of the project. We also did quite a lot of ad hoc involvement with young adults. So exactly the same kind of format as we used that I just described, but the groups would change each time because those particular young people often weren't particularly interested in committing to coming to more than one group. So we would just join forces with Hampton Trust and attend a different workshop with them. We also felt it was important to ensure victim perspectives were represented. So we partnered with a charity who represented victims of crime, and they were able to support and advocate for victims. And lastly, we felt it was really important for kind of the wider community to have a say in this project. So we plan to undertake a range of consultations with community groups and leaders about the intervention and about the research. So that was my first case study. My second case study is slightly different, but again, I think hopefully this can show a slightly different approach to undertaking patient and public involvement, a different recruitment method, a different way of holding meetings. So hopefully we'll kind of illustrate that it really is so dependent on the project that you're doing and the people that you're trying to kind of work with and partner with to think about exactly what the right format is and what's going to work best in a case-by-case way. So this was for a project that we supported at the RSS. The title is a randomized controlled trial of serial prophylactic exchange of blood transfusions in pregnant women with sickle cell disease, aimed at improving maternal and infant outcomes. So this was an NIHR Health Technologies Assessment application. It is still in development. All of this information is being shared with permission. So thank you again to the team who've said that we're able to talk about some of these activities. So for this study, the project was, so in terms of the PICO, the project was pregnant women with sickle cell disease. And I think it's worth noting here, because this was something that we needed to consider when thinking about the patient and public involvement. Sickle cell disease disproportionately affects people from different kind of ethnic backgrounds, so particularly people of African descent and some other ethnic backgrounds as well. So that was something that we really needed to think about, and there was a focus within the application and the project thinking about kind of maternal health inequalities and outcomes as well, and the sort of impact of race and things like that on maternal health outcomes. The intervention in this case was that was proposed was to be giving regular preventative blood transfusions throughout pregnancy. So it would have involved women coming to Guy's Hospital in London and having a blood transfusion on a regular basis throughout the course of the pregnancy. These are, I'll go into a little bit more detail on this in a minute, but they're kind of quite long appointments, and they can kind of make patients feel quite unwell for a few days afterwards. So it's quite a significant undertaking potentially. The control here was usual care. So usual care, it would be essentially giving transfusions in emergencies. So only if there's an emergency relating to kind of sickle cell symptoms. And the outcomes that were being collected were a range of maternal and infant outcomes. So this included mortality, birth weight, admission for sickle cell disease related complications and things like that. So the team had already done quite a bit of feasibility work and really wanted to work through some of the main challenges to recruitment that they'd kind of come up against in their feasibility work. So this included some caution towards and around the idea of transfusions, which was particularly prevalent in some kind of cultures and communities that are disproportionately affected by sickle cell disease. So a kind of a fear or reluctance to kind of have blood transfusions for a number of different reasons. The team also wanted to understand what were the most important outcomes to women, and what the burden of the study would be on participants. And as I mentioned, the intervention itself is potentially quite kind of time consuming and quite challenging. So what could be done to kind of support and facilitate participation? And then also, given the kind of cautiousness around transfusions for some, the team also wanted to explore what some of the main safety concerns in the context of the study, and explore what they might be able to do to kind of try and mitigate these concerns, to try and ensure that they're providing the correct information to potential participants for them to make an informed decision about whether they wanted to take part. So the research team already had a PPI collaborator who they were working really closely with following their feasibility work, Janine. So this is Janine here. Janine is a PPI contributor who has sickle cell disease, and she's a really active public contributor who does a lot of advocacy work for people with sickle cell disease. I think it's worth just mentioning, Janine didn't actually want to be a PPI co-applicant because of some of the formality around the process, and that just didn't suit her and her individual circumstances. And that is absolutely fine, and kind of funding bodies should recognise and do recognise that sometimes the kind of formal co-applicant route isn't necessarily the right one for PPI contributors. So she was a sort of named public collaborator. Her role, to all intents and purposes, was very similar to that of a PPI co-applicant. It just was slightly different in terms of the formality of it. So Janine was able to use a closed Facebook group for which she sort of helps run. And this was a group for people living with sickle cell disease. So she used that to identify 6 women who either had children or were thinking about having children who had sickle cell disease. And these individuals were from all over the country, so they weren't necessarily local to one area. So because of that, we decided that the best thing to do would be to set up an online PPI meeting so that people didn't have to kind of take into consideration traveling and things like that. So Janine actually ran the meeting, so she kind of coordinated it, she set it up and she facilitated it. And at the meeting, the group were able to talk about their experiences of pregnancy and birth with sickle cell disease, and also their kind of, you know, what they might be concerned or worried about if they were to get pregnant and have a baby. So the group felt that information aimed at young women about transfusions could also be further developed to share with family members who may also be reticent and who may kind of influence a woman's decision whether or not to take part in the research. And so that was a really interesting suggestion, and as a result, plans to develop a whole range of different resources have been kind of put together. And these resources are kind of aimed at participants, but as well as participants, their kind of support network and anybody who may want some additional information about their sort of family member or whoever it may be taking part in the study. Similarly, similarly to the previous case study, the group also recommended a range of different media should be used. So they spoke about using kind of videos and of kind of women living with sickle cell disease, videos featuring women living with sickle cell disease who sort of look like them and who are representative of them, who were able to kind of share information about the study. As well as the outcomes that were already identified by the research team, women wanted more of an emphasis on quality of life and more emphasis on infant outcomes. So additional outcome measures were included to capture this. And lastly, as I'd already alluded to a couple of slides ago, the burden on participants was felt to be really, really significant. And I think this is an ongoing challenge. So I suppose a good example of how PPI doesn't necessarily give you the answers, but it kind of can give you a working dialogue to kind of think about challenges. So the recruitment for the study was being held over quite a large geographical area, but the study itself was being held at Guy's Hospital in London. And the transfusion appointments were often very long, up to a full day. So once you've sort of included travel in that, then it was a very, very long additional regular appointments for people to attend. Women with children were particularly concerned around implications on things like childcare, particularly for single parents was seen as a challenge. So lots of things there for the research team to work through with their public contributors and think about what might be the best approach. In terms of the ongoing plans for PPI with this particular study, so Janine will lead the PPI activity as PPI collaborator. So she will kind of liaise with the other members. So the 6 members of the group were happy to form a PPI group, and we're going to continue to support the project as it was, if it was funded and as it was delivered. So Janine's role was a PPI lead, and she would kind of facilitate and coordinate that. As a group, their role would be to continue to think about lots of those recruitment challenges and issues that I've already alluded to. So they would play a role in kind of co-developing recruitment materials and information for participants and family members, and also continue to think about how the team might help overcome some of the challenges around the burden to taking part in the research. So this includes things like provision of funds for childcare, ensuring that efforts are made to try and align transfusions with other existing appointments on the day, so that can minimize travel and things like that for potential participants. Okay, so yeah, hopefully, so there was 2 examples there of 2 different approaches to PPI. Hopefully that was useful. Obviously, I think what's really important to sort of reiterate again and again with thinking about patient and public involvement and planning for research projects is there is, as first thing that Paul said, there's no one size fits all, and it really does depend on the research project, the research team, the work that you're doing, the population, the members of public who you're kind of hoping to partner with and who you're hoping to work with, and finding an approach and a tailored approach that works and that is the most accessible and the most suitable for the people that you're hoping to collaborate with.